you know, sticking on that a little bit, would you ever advise someone to purchase their own hyperbaric chamber as a complimentary thing, you know, afterwards, let's say?
Well, Mo, I want you to answer that in two ways. So first, and I'll have Mo address the safety, but there's two types of hyperbaric chambers that people think about purchasing. The most prevalent one is the tent-like versions, the ones that zip up. Those only go to a certain pressure. And so you're not able to get the benefit in terms of oxygenation of the tissue, let alone the increase of stem cells in those. They might be great for some recovery after pretty exhaustive exercise, but their limitations stop there. Mo, we've had a number of our clients who've expressed interest of installing a hard monoplace chamber in their homes. I'll let you address some of the safety concerns that you and the team have around that.
Yeah, when you asked Dr. Efrati from Israel, what about these tents and these home chambers? And forgive me again for quoting, but it's bullshit. That's not hyperbarics. True medical hyperbarics involves these hard chambers, whether it's a mono chamber or a multi-place chamber, but the ability, as Dave mentioned, to get up to that specific pressure level. Some of those tents and home chambers can go maybe up to 1.3 atmospheres, and there might be some benefit in some recovery here and there. But the purpose of our treatment is to make a significant physiologic change in the body, producing a significant amount of stem cells and growing new blood vessels, improving the mitochondrial function. We didn't really mention that. That can only be done by doing this specific protocol. Now, for those who are able to buy or purchase a hard medical chamber and put it in their house, this is a medical device. You wouldn't perform surgery on yourself at home. And I want people to think of it like that. There are a lot of risks if hyperbarics aren't done properly. My team here, they're the top professionals in terms of safety and administration of this medical treatment. That's what this is. If you dare to Google hyperbaric accidents and you see explosions and catastrophic issues, even in some clinics that don't do it properly, you need to have a thorough, certified team to really administer this treatment to make sure you're doing it properly, not just for the obvious explosions with oxygen, but even for your health. Breathing too much oxygen in an unsupervised way is dangerous. Oxygen-free radicals, oxygen toxicity, those are real things. So even if you don't have a catastrophic explosion, you could be hurting your health by just sleeping in an oxygen tent for God knows how many hours.
Yeah, and I saw that safety area you guys have there at Aviv, and it is impressive. It looks like a whole thing, that you'd see in the CIA or something, overlooking everything, all the buttons and systems they got to overview. So I get it. It is, as with most therapies, trying to do something that is a medical therapy and procedure at home is usually not the best, and cutting corners on that is usually not the best idea. We see that a lot. We do ozone therapy and different types of therapies, oxidative therapies here, and people try and say, let me mimic that at home. And it's like, well, you really shouldn't be playing around with that, especially when it's your health and you have, all these medical professionals available to you.